Welcome to Talk 1260 KTRC. You are listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel, plastic surgeon, and I have a great guest today, Dr. Gabriel Roybal, who has been a dentist here in Santa Fe for 24 years, and we share the same roof. And he has taught me some amazing things, including what we're going to talk about today, which is the relationship between, and this is really hot right now in the media, the relationship between periodontal disease and cardiovascular disease. Hello.
Howdy. Thank you so much for letting me be a part of this, Dr. Ronel. I appreciate it.
So what are you doing in Santa Fe?
Well, one of the things that I'm really excited about, some of the services that we're able to provide for our patients has a direct correlation to people's health right here and right now. The correlation between heart disease and periodontal disease is getting to be at a point where we understand it and are able to manage it in an effective manner with the technology that's available, and we're able to do that right here in Santa Fe, New Mexico.
That's amazing that you go to the dentist and they actually tell you about something as important, if not more important than your teeth and your beautiful smile, is, you know, your risks for heart disease.
Heart attacks, heart disease, the plaque that builds up in the heart is identical, or at least the markers for it are identical with the tests that we have. We can do DNA workups on the patient, we can do DNA workups on the actual cultures that we can take from a patient's mouth.
Huh.
It's not LA, it's not New York, it's right here in Santa Fe, New Mexico. Some of the stuff that we're doing is so cutting edge. The science is behind it now. It's provable. There's some organizations, medical organizations in Texas, that are now guaranteeing if you go through their program, they will guarantee that you will not have a heart attack. I find that remarkable. I don't understand all the details of it yet, but what it speaks to is the development, or at least the stage that we're at now, with the technology that's available from simple cultures. It's a simple swab. It's not even a blood draw or anything. It's a simple swabbing of the saliva and the mucosa in the mouth to get the workup. And
then a DNA analysis of that, and that sort of stratifies you into a risk category.
Exactly.
And then you refer them to a doctor,
Appropriate.
Amazing. And do you do this for all your patients, or do people come to you for this testing?
We are making it a part of our protocol. It's so important, and the correlation, it's one of the few things this day and age where it's relatively fast and expensive and easy. It's painless, it's cost effective, and I would say the accuracy of the tests are remarkable. It's not grandma's and grandpa's dentistry that it used to be 10, 15 years ago, or even 1 or 2 years ago. There's only a few practices in the country, and we happen to be one of the few of them in the Southwest that is actually providing these types of services. The medical community, it's so new that it's very unfamiliar, but the science is there, it works well, we're good at it, and it's a privilege to provide patients that kind of information, because most of the time the thinking behind dentistry is you go get your teeth cleaned, maybe get a crown or something, maybe a smile done, get your teeth whitened, fillings done, extraction, something like that. But now when you go to the dentist and get that kind of workup that so relates to this day and age, to do something with reliable tests this early in the game so that you can actually address it before something shows up, it's incredible. And it's relatively easy and inexpensive.
Yeah, no, that's a really fantastic service that you can get. Just so you know, the address of Dr. Roybal's practice is the same as mine, 444 St. Michael's Drive.
Right across from the hospital.
Yes. What other things do you do there?
Some of the things that excite me, we're doing a couple of things. We've opened up an indigent clinic here in town. It's not at the same location, it's a different location. But what we're able to do with the service that we provide at St. Michael's, we're able to take care of patients that don't quite have the resources or the knowledge about what's available at a very cost-effective, if not free, fee basis. One of the things that we've done, we've adopted just in this past year, 120 United Way families, which means if you're a mom, a dad, a kid, a grandparent, you come in and the services are free.
Yeah, Dr. Roybal won the Humanitarian of the Year award from the United Way last year.
That was very generous of me anyway, but
Well, you deserve it.
thank you.
That clinic is on the other side of town, on
Yeah,
Kaia
it's
Mejia.
in Kaimahia, right across from the National Cemetery.
Right, right,
But the services that are there are basic dental services. It's not the kind of service that we provide up over here.
right,
But
right.
the technology is available there as well.
Right. And so, on the other side, right next to my office, you're doing veneers, you're doing
We do
porcelains.
more of the traditional, and it's not even so much traditional. One of the things that has me really jazzed these days is the type of porcelain that we're able to use today. It's called the Ceric Emax. I have not had a failure with Ceric Emax. One of the trade-offs was that in the past you either get form and function or you get aesthetics. The new porcelains these days are such that you can get the looks, you can get the color, you can get that natural look where it doesn't look like your teeth were done, they just look like you have nice teeth.
Right.
And they wear well, they wear at least 5 times better than your natural teeth, and they don't fracture.
Mhm.
We're able to bond them in there successfully, they look fabulous, they work well. That's the most biocompatible material that we have. And they're gorgeous, and patients love them, and the tissue that we place them in loves them. There's no metal, there's no chemicals.
It's green.
It's great to get the looks and the function and the durability. That's really a home run. That's what has me really excited now. Because one of the things that we struggled with is you could get the looks, but say somebody was to do something inappropriate, like cut some thread or some string with a natural tooth that could possibly break. If you did it with a porcelain veneer or something like that, it was such that there was a possibility it may break with this new Emax system. Not to encourage people to abuse their teeth, but it is so strong. We have people doing really nutty things, but we haven't had any failures, and that really gets me excited. They look gorgeous and they work well.
Yeah, that's right. One of the things that I also like about your practice is people who are very nervous about going to the dentist, very apprehensive. You have a very special person on your staff who can help them.
Yes, one of my hygienists is a clinical hypnotist. They can hypnotize patients to lessen the degree of anxiety. Some of the things that we have a acupressure, acupuncture, massage therapist. One of the things that's so remarkable about having that service available, I've been doing this for many years, the amount of anesthetic and the amount of anxiety that a patient goes through when they're getting significant dental work is substantial. What I find is we have people like Sid, who's an acupuncture massage therapist there in the practice. She can come in and relax the patient with some of her traditional therapies, which are non-invasive by and large, but I use about 1/3 amount of the anesthetic in about half the amount of time. So having that service available to patients, boy, that really takes the edge off for quite a few people. They love it. It makes the procedure faster. The patients tolerate the procedures better. They heal faster. And it makes my life a whole lot easier simply because I don't have to work so hard to use so much analgesics or anesthetics to get them comfortable. It really is effective. To knock off 2/3 of that anesthetic, it's really, really a nice service.
Awesome. I'm talking with Dr. Gabriel Roybal, dentist extraordinaire. How do people reach you? What's your phone number?
We're on St. Michael's. We're right next to each other, 444B St. Michael's Drive, 989-8749, San Fe, New Mexico.
Okay, we have to wrap things up. I want to say thank you to our sponsor, Geneva Medical, the makers of Artifil. We'll be right back with a tip from Dr. Rita Dodge. And Gabe, thanks very much.
Thank you, Dr. Ronel.